Namaskar and warm greetings to everyone who is hearing me at this moment. Well, I am Sanskriti Acharya, a student from Global College of Management. I currently study in 12th standard. First of all, I would like to thank and at the same time congratulate the entire team of the Global Debate Club for coming up with such a wonderful idea of providing the students with such a wonderful opportunity of expressing their views and opinions regarding such an important topic. Without any further delay, I would like to express my personal views and opinions regarding the topic. Today, we all are facing a global health crisis unlike any in the 75-year history of the United Nations. You can call it the one that is killing people. You can call it the one that is spreading human suffering. You can also call it the one that is responsible for upending thousands of people's lives. But this is much more than a health crisis. In fact, it is a human crisis. The coronavirus disease, also popularly known as the COVID-19, has been attacking the societies, the localities, the communities, the countries, in fact the entire globe at their core. The Shukraraz Infectious and Tropical Disease Hospital in Teku, Kathmandu has been designated by the government of Nepal as the primary hospital along with Patan Hospital and Armed Police Forces Hospital in the Kathmandu Valley. The Ministry of Health and Population, also popularly known as MOHP, has requested and has been requesting the 25 hub and satellite hospital network across the country, which is still unaccomplished. It has been designated for managing mass casualty events to be ready with infection prevention and control measures, and critical care beds were available. But unfortunately, there are really less number of critical care beds that is available in our country right now. The government is allocating spaces for quarantine purposes throughout the country, and some sites are populated with a lot of people, a lot of the infected people. On 24th March 2020, the government had imposed a complete lockdown of the country, including business closures, industrial closures, and many more. This had led the country to pursue it towards a huge crisis, because of which the lockdown has finally reopened. So the pre-existing societal structures, social norms, discriminatory practices, and gender roles create or contribute to heightened risks for vulnerable groups including children, persons with disabilities, and many more. Humanitarian response must ensure that different needs, priorities, and capacities of all people, irrespective of their gender, are addressed when designing, planning, and implementing the humanitarian response efforts. Particular attention must be given to women and girls, especially from excluded or vulnerable groups. Secondary economic impacts of the outbreak is prolonged, in particular for women and excluded and vulnerable groups too. As months keep passing, officials have still failed to come up with the solutions to resume classes and exams. Students now face an uncertain future, especially with girls from low-income households are facing the highest risk of school dropouts. Arijit Lohan, like millions of other Nepali students like us, has waited over 6 months for classes and exams to resume. But unfortunately, nothing has been going as planned. If everything had gone as planned, the 19-year-old would now be planning for the university entrance examination. But after the Nepalese government suspended all classes and exams due to the coronavirus pandemic until the further notice, all that guy can do is wait. He says that his entire plan had collapsed. He has been waiting for this moment since a long period of time. He has been waiting for the academic session to begin, but nothing seems to work. One entire academic year has become a waste for such students. So unlike their private counterparts, state-run schools and colleges are not sufficiently equipped to run online platforms. Further, entrenching the divide between Nepal's haves and have-nots. So almost 80% of students in Nepal are enrolled in public schools or colleges according to the Education Ministry. But even those students who are studying in public schools or colleges are facing the same circumstances the people outside are facing. So the government decisions are not destroying, they are not only destroying a complete academic session of the students, but also pressurizing them at the core. The students do not have any idea about what exactly they are supposed to do. This pressure has led to so many suicide cases by now. The students aren't able to handle the pressure and they are preferring to hang themselves. Now the government only has two options. One, to inform the exact date of taking their examination, and the second is to make an alternative decision because the students can't handle the pressure and pain the government has been providing them since so long. It's enough already and the decision has to be made. Saying this, I would like to conclude. Thank you so much.